Hello everyone, welcome to my YouTube channel on studies in relation to community medicine. You know that in community medicine, recent advances are very important. We have to always keep an eye on the recent advances of the national health policies and health programs which are being launched by Government of India, which is going to become a very important intervention in public health and reaching to the unreached in the community. Very recently, there has been a policy declared by Government of India, and on 13th of September, Government of India has launched a campaign called the Ayushman Bhavah campaign, which is a combination of various strategies which are being being implemented by various national health programs, which will be combined together in a campaign mode. In today's class, I am going to take you through in the recent advances series, which will include the various details of the Ayushman Bhavah campaign. So let's get started and stay updated so that you may not miss a chance of answering a very tricky question which may be asked on these national health policies and recent advances in your competitive exams like NEXT, FMGE, NEET, PG, INI, CET, etc. And also this may be helpful in various exams of your undergraduate level and postgraduate level. So let's start. Hello everyone. Let us talk about the Ayushman Bhavah campaign, which has been launched by the Government of India today, the 13th September 2023. So this is one of my videos in the Community Medicine Recent Advances series. Let us go through the topic. So today, the 13th September, this campaign, Ayushman Bhavah, has been launched by the Honorable President, Government of India. So what is the background of this campaign? So this campaign is envisaged to saturate all identified healthcare services in every village, town, in line with the commitment of Honorable Prime Minister Shri Narendra Modi to ensure reach to the last mile and enable access to the healthcare services to everyone in the society. So Ayushman Aapke Dwar, Ayushman Mela, which is health camp and wellness health camps at health and Ayushman Mela at the health and wellness center levels, and medical camps by the medical college at the CHC level, and Ayushman Sabha are the three main components of Ayushman Bhavah campaign. So the main components are: number one is Ayushman, so number one is Ayushman Aapke Dwar phase 3.0. This is one. Second is Ayushman Mela. At which level, which health institutions? Health and wellness centers and at the community health centers by medical colleges. Okay. And the third is Ayushman Sabha. These are the three main components of this Ayushman Bhavah campaign. So why this campaign? We know that more than 65% of population in India are living in rural areas. So rural area population is still 65% is number one. And the LSDG initiative involves action along 9 thematic areas that take the development agenda forward in the form of Healthy Village Initiative. So we shall go into understand what is Healthy Village. And also if we look into it, 6.45 lakh villages suited in more than 2.55 lakh gram panchayats. 6.45 lakh villages are there in India. And how many gram panchayats? There are 2.55 lakhs of gram panchayats in India. Okay. The panchayat implements development program under the overarching mandate, supervision, monitoring of Gram Sabha. So Gram Sabha is such a sabha which looks into how to implement the development programs in the village. They are the monitoring committee in the villages. Okay, this is the one of the backgrounds of this Ayushman Bhavah campaign. Now, understanding what is Gram Sabha, the Panchayat implements development programs under the overarching mandate, supervision and monitoring of Gram Sabha. So, Gram Sabha is the committee which looks into the development of the Ayushman Bhavah campaign, the development of the villages in every sector. So, in Ayushman Bhavah campaign, the Gram Sabha will work with the concept of leaving no one behind, leaving no village behind, and Antodaya. Antodaya means reaching out to all. So the last person, reaching out to the last mile, the person who is unreached, to reach up to them through Antodaya Yojanas. Now, the urbanization with estimated urban population of 675 million by 2035. So by 2035, year 2035, there will be 675 million people in urban areas also. So this is also an estimate. Okay, so urbanization in India has grown significantly due to rural to urban migration. Why urbanization is occurring? That is another demographic shift we have to understand. Urbanization in India has grown significantly due to rural to urban migration is one reason of that. Rural to urban migration. So the areas are not transforming into urban areas sometimes, but the population is moving from rural areas to the urban areas. Okay, so rural to urban migration is one reason. Then economic opportunities, industrialization. Why this has occurred? Due to more economic opportunities in urban areas. Then industrialization gradually expanding from urban to rural areas. So urbanization occurs in this world, in those areas. Improved education and healthcare access. Health care access. Okay. Introduced challenges such as increased pollution, lifestyle related disease, and health disparities in urban poor. So see, the rich people, they live in good living condition. They can maintain a hygienic environment. But what is happening to the poor who are coming to the urban areas? They are becoming vulnerable due to pollution in urban areas. Another is lifestyle related disease. And also health disparities among the poor. So this is what is happening to the people who are rapidly moving from rural area to the urban area. Okay. So Ayushman Panchayat and Ayushman Ward is another campaign which is being launched along with this Ayushman Bhavah campaign. So you have to understand what is being included in this Ayushman Panchayat and Ayushman Ward. Here, government has given certain indicators for healthcare facility, development in every village and ward. So what will happen? There will be healthy competition between these villages and wards, panchayats and wards, based on these indicators, and the successful will be awarded. So there will be certain criteria based on which the panchayats and wards will be identified, how much development has occurred, based on which will be evaluated based on certain indicators. We shall come to those in this presentation itself, and based on this they will be declared as Ayushman Panchayats or Ayushman wards, and they will be rewarded. So what is the purpose of this? To enhance awareness of Pradhan Mantri Jan Arogya Yojana, Bhavah ID generation, and services related to screening and management of non-communicable diseases, TB, sickle cell diseases. These are being highlighted in this Ayushman Bhavah campaign through the Ayushman Panchayat and Ayushman Ward. Also, another area which is being highlighted is linked with the National TB Elimination Program, which is the TB Mukt Panchayat initiative. We shall also discuss in details that there will be certain indicators to declare a village's panchayat as TB Mukt Panchayat. There is also scope for winning awards and declaring a village's panchayat area as a TB Mukt Panchayat area. We shall come to that. Now, coming to the three primary components of the Ayushman Bhavah campaign, the Ayushman Aapke Dwar 3.0. So this is a phase 3.0. This means there had been one phase 1 and phase 2 as well. So phase 1 and phase 2, those were successfully undertaken with the key objectives. There were objectives of improving awareness and increasing Ayushman card penetration. So awareness generation regarding Ayushman card, that is AB, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. So first phase 1 was creating awareness, and phase 2 was card penetration. Which card? Ayushman card. So here massive campaigns were taken to give people the Ayushman cards. Okay, so now it is phase 3. Phase 3, these activities will be further intensified. Now coming to health melas, earlier there were Ayushman melas. Now from 17th, the program has been launched on 30th September, but activities will start from 17th September. From 17th September onwards, there will be Mela, health Mela in the Health and Wellness Center, and also Melas will be in the Community Health Center. The Melas in the Community Health Center will be done by specialist doctors from medical colleges. And at the HWC level, it will be organized by the community health officers. Community health officers, and who will support them? The multi-purpose worker or MPW, ANM, and ASHAs. They will be supporting the community health officers in organizing the Mela at the HWC level. Now thirdly, the Ayushman Sabha. So Ayushman Sabha is related to the Swachh Bharat campaign. And what is the relation of Swachh Bharat campaign in health sector? Nothing but infection control. So these are looked after by two major activities. One is the Kaya Kalp, which is related to infection control in health facilities. Another is quality assurance. So we know that National Quality Assurance Program. So mainly the Kaya Kalp is related with the Swachh Bharat, and Ayushman Sabha is a sabha which is held on 2nd October, Gandhi Jayanti, the day of Gandhi Jayanti, every year, where they talk about implementation of Swachh Bharat campaign in every village. The Gram Sabha takes necessary action to and also to implement various projects and programs, not only health and also other sectors, through which people can be benefited. So this year, in this Gram Sabha on 2nd October, this Gram Sabha is being called Ayushman Sabha, and various healthcare related activities and awareness generation will be the priority in this year's Gram Sabha, which we shall come to discuss in details. Now, Swachh Bharat mission, now it is going on as the phase 2 of the mission. The phase 1 of the mission was related to open defecation. I hope you all know what is open defecation. So it was related to ODF, or open defecation free villages, ODF villages. And phase 2 is now looking after the Kaya Kalp, mainly the developing infection control in health facilities. Okay, the phase 2 is mainly focusing on that. So, and then what will happen on the during this day's mission? They are mainly focusing on the Kaya Kalp assessment. So for this you can look into my upcoming video, where I shall discuss about the Kaya Kalp assessment and Kaya Kalp initiative, where under certain indicators the infection control measures of a health institution will be evaluated. It will start from which facility? Kaya Kalp, it will start from sub-divisional or sub-district hospitals, district hospitals, and sub-district hospital, district hospital, and medical colleges. Kaya Kalp evaluation will take place in these facilities. So I hope till now there is no confusion. So 3 major components coming up to them once again. The Ayushman Aapke Dwar phase 3.0 is now this year being implemented. So earlier was Ayushman Aapke Dwar phase 1, phase 2 and phase 3. Okay. So Ayushman Aapke Dwar 2.0. In 2.0 what we have done? 1st August onwards, the IT platform, mobile application based card generation was highlighted. So we have discussed that. First one was regarding awareness generation, second one was card generation drive, that is ABPMJY, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana related cards, health card, and then Ayushman Aapke Dwar, which has been included in the Ayushman Bhavah campaign. It is related to the intensification of the ABPMGY card generation. So remaining population, the target is to complete card generation for all eligible beneficiaries who are left out. So anyone who is eligible for this card and have not got the card, the target of the 3.2 is complete the task and get everyone their Ayushman card. So how the card will be registered? So here ASHA workers, frontline workers under Panchayat Raj institution and self-help groups under the National Rural Livelihood Mission, National Rural Livelihood Mission, or NRLM, NRLM. What they will do? They will mobilize the beneficiary and collect the eKYC. We know that in banks there is KYC, know your customer. So where photo ID details, identification of the beneficiary is generated. Here also photo ID based identification of the beneficiary will be done and card will be generated, and they will be mobilized by the ASHA, the Anganwadi workers, the National Rural Livelihood Mission or NRLM employees, and eKYC will be generated. And also IC or Information Education Communication, IC activities or awareness generation will be done. So who is looking after this activity? The NHA, National Health Agency, National Health Agency. They are the national level nodal agency for looking into this Ayushman Bharat Pradhan Mantri Jan Arogya Yojana card generation. Okay, so card creation, the method will be here. Eligible beneficiaries can create and download Ayushman card themselves and their family members. So they can do themselves also. There will be tutorial videos given by the NHA platform or through and the YouTubes, and leaflet highlighting stepwise process of the card generation will be distributed among people, through which they will learn that how this card generation has to be done. So there will be dual mode. Number one is people will be mobilized where eKYC will be collected, eKYC based card generation will be done in the camps, and second one is awareness will be done through the social and electronic media and leaflets, so that people learn how to generate their own card for themselves and for their family. So who will be the nodal officer? The district collectors or the DMs will be the district level nodal officers for this Ayushman Aapke Dwar 3.0, and CMO or civil surgeon. So chief medical officers or civil surgeons. So we know that in some states the designation is district chief of the health department is known as a civil surgeon or chief medical officer. They will be the nodal head from the health department for this entire activity. The frontline workers shall be targeting to create 100 to 150 cards, Ayushman cards on a daily basis for mass mobilization engaging frontline workers. Frontline workers, we all know what is frontline worker. Frontline worker means MPW or ANM and ASHA. They are the frontline workers. So also here frontline worker means NRLM, National Rural Livelihood Mission employees. So they will visit mobilize the beneficiaries. They will be, each of them will be given a target of generating 100 to 150 cards on daily basis. Okay. For mass mobilization, engaging frontline workers and creation of agencies, fair price shops, local public representatives may be roped in. So fair price shops is another place where people regularly come for collecting their ration giving by the PDS service. So fair price shops, and people's representatives also have the political leaders. They have a good connection with the people, so they can mobilize the people. So their benefits, their help also can be utilized. And if eKYC is undertaken by frontline worker, NHS shall pay a sum of ₹5 for every successful eKYC, further ₹3 for every Ayushman card delivered to the beneficiary. So if one eKYC is generated by FLW, ₹5 will be awarded, and card generated and handed over, ₹3 will be given to the frontline worker. Now coming to the next component, Ayushman Mela. So these there are health issues that range from unfinished agenda like reproductive, maternal, newborn, child and adolescent health to the accelerating burden of non-communicable diseases, including such non-communicable diseases, and also TB, mental health, emerging and re-emerging diseases and injuries and road traffic accidents. So there are certain health issues which are still bothering our population. So these have to be taken care of in the Ayushman Mela. Deaths due to non-communicable diseases in India is very high, 37.9% in 1990 and 61.8% in 2016 have died. Among the deaths have occurred due to non-communicable disease. So how there have been a epidemiological transition. Another issue is malnutrition, which has emerged, both undernutrition and overnutrition. From NFHS 5, National Family Health Survey, NFHS 5, what we have known that prevalence of stunting were reduced from 38.4% to 35.5%, wasting and underweight, these have reduced. So undernutrition is not an issue, but lifestyle disorder and NCDs are becoming an issue. That is the main point we have to understand. So there is a epidemiological transition from malnutrition, overnutrition is coming up, maternal child health disorders have been taken care of, but there is overnutrition and lifestyle disorders which we have to take care of. So Ayushman Bharat is a flagship program of Government of India launched in 2018. Ayushman Bharat was launched in 2018 with the sort of universal health coverage. Okay, it started with 4 pillars. 4 pillars. One is Ayushman Bharat Health and Wellness Center. Second is Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. Third is Ayushman Bharat Ayushman Bharat Pradhan Mantri Ayushman Bharat Health Infrastructure Mission. Okay, so we shall in next videos, upcoming videos, we shall be discussing details about this. And the latest one is Pradhan Mantri Ayushman Bharat Digital Mission. PMABDM. These are the 4 pillars of the Ayushman Bharat. So these 4 pillars we shall be giving detailed videos about each of these pillars. So because we have to understand what are these things, we shall coming up with the next videos on this. So discussing about the Ayushman Melas. What is the objective of Ayushman Mela? The main objective is providing services in the form of early diagnosis and prompt treatment. Secondly, awareness generation. And thirdly, bridge the gaps by creation of Bhavah Health ID, Bhavah Health ID or and Ayushman Bharat card, AB PMJY Ayushman Bharat Pradhan Mantri Jan Arogya Yojana cards providing routine immunization. So these are for included as the concept of bridging gaps. Okay, so this is the banner for Ayushman Bharat Health and Wellness Center weekly Mela. So from that it is revealed that this Mela will be every week. Then fourthly, it is also meant for the follow-up of Pradhan Mantri Jan Arogya Yojana beneficiaries. So whether they are getting the benefits after the card has been generated. So these are the objectives of the health Mela. So what is the schedule of the health Mela? We have known that every week on Saturdays. So every Saturday there will be health Mela at the health and wellness centers. So every week different services will be given in the health Melas. There will be a core planning and implementing team who will be doing the planning. So for health Mela, there will be planning by medical officer in charge for PHC level health and wellness centers, then staff nurses for PHC and urban PHC level health and wellness centers. They are the core planning team. At sub-center level health and wellness centers, there will be community health officers or CHOs, yoga practitioners, and other wellness instructors, and also representative from the Jan Arogya Samiti, from Village Health Nutrition Sanitation Committee, from the Mahila Arogya Samitis in the urban areas, then self-help groups, National Rural Livelihood Mission or NRLM and National Urban Livelihood Mission. So these people will be doing the planning. They will be under the core planning unit. Along with them, there will be Panchayat Raj institution members, then school teachers, staff, etc., then local media, some prominent members of the community, members of the youth groups, prominent members of the community, members of youth group, in these melas also the community health center, sub-district hospital, district hospital shall be engaged. Collaboration will be with the block development officer or BDOs and cooperative societies. This is the core planning team of core planning and implementation team for the Health and Wellness Center melas. What are the common services to be given at the HWC Mela? There will be certain common services under 3 heads. One is registration. Number 2 is healthy lifestyle promotion. And thirdly is teleconsultation. So under registration, what will be the activity? Bhavah ID generation. Okay. Population enumeration. So we know what is population enumeration through non-communicable disease program. We shall be discussing when we shall discuss in our class related to non-communicable disease. Then updating family members. So whenever a new family member is added in the family, the profile needs to be added in the Bhavah ID and PMJY card. Okay, in PMJY Ayushman Bharat card. Ayushman Bharat card issue. So these are the things as routine service to be done given at the HWC Mela to the beneficiaries under the head of registration. Now healthy lifestyle promotion, there will be wellness activity, and promotion of balanced diet. These are to be given under the healthy lifestyle promotion as a routine service in all health and wellness center melas, means every Saturday. Teleconsultation, we know that through teleconsultation any service or any case which is not being managed at the HWC level to be communicated to the higher centers for specialist advice, specialist consultation. It is being done by the teleconsultation being done by the e-Sanjeevani platform. So if there is opportunity, we shall have a video lecture on this. Now, what are the theme specific services? So every Saturday there is going to be a specific theme. Related to that, services will be given. So what are those themes? Number 1 is non-communicable diseases or NCDs. So all services in related to non-communicable diseases, like related to hypertension, diabetes, cancers which are included in the program. What are those cancers? Oral cancer, breast cancer. So diabetes mellitus, hypertension and cancer screening and management. Cancers under the program, we are looking for oral cancer, cervical cancer, breast cancer. So screening of hypertension, diabetes and cancers will be done. So for cervical cancer, the activities we know that VIA, we have to look into the non-communicable disease section for this. So we shall, if opportunity permits, we can have a discussion on the national program for non-communicable disease, where we shall discuss in details about this. Then screening for mental health disorder by utilizing the PHQ scale, PHQ 9 scale by the CHOs. So mental health disorders will be screened for, and also for COPD, chronic obstructive pulmonary disease. Screening for COPD also has to be done. So this will be done on the first Saturday of every month. First Saturday of every month on the NCDs, non-communicable diseases. Now coming to the second Saturday, theme is communicable diseases. Second Saturday. So it will be related to TB, leprosy, viral hepatitis, all those activities for against which programs are there. So if you do not know the program, please follow my upcoming videos where I shall be covering the national health programs one after another. HIV AIDS, we know that there is a program called National AIDS Control Program. Now vector-borne diseases, malaria, Kala Azar, these vector-borne diseases. So these communicable diseases mainly will be taken up in the on the second Saturday HWC Mela. So what will be done under all these programs? There is screening activity, then data entry, then putting into treatment. All these things will be done. What is done under these programs, and any benefits if to be given to the patients in relation to availing the services. Sometimes some incentives are given to the patients as well, like TV and Nikshay Poshan Yojana benefits. So all these will be ensured in the second Saturday melas. Now third Saturday it will be on RMN CHA plus N, that is reproductive and child health related services. So early diagnosis of pregnancy, then early registration of pregnancy. So starting with preliminary services. Now mother and child protection card distribution, MCP card, mother and child protection card, then antenatal checkups, okay, TT, iron folic acid to the pregnant women, identification of high risk pregnancies, then promotion of exclusive breast feeding, okay, neonatal checkup for malnutrition, severe acute malnutrition, okay, then IOICF or integrated young child feeding, okay, community awareness, identification of acute respiratory tract infection, pneumonia. So all services in relation to maternal child health, okay, and adolescent health, adolescent counseling. Related to various things like menstrual hygiene, etc. So all these maternal child health and nutrition related activities. Now 1 week is left, so this is on the third Saturday. So fourth Saturday is left out. So here flexibility has given to the states to decide their state specific activity. If anything they want to highlight, they can do on the fourth Saturday. So these are the basic activities to be done at the Health and Wellness Center weekly mela, to be done on every Saturday. Now secondly, another main part of the mela is at the community health center medical camps by medical colleges at the CHC level. So what will be done in these melas? So we know that in 2022 Indian public health standards, in community health centers we need specialist doctors. So we at present do not have these. We have specialist doctors up to the district hospitals, not below that. We are having in some CHCs but not everywhere. So medical colleges have been asked for supporting in providing specialist doctor services in the CHC. So what is the objective of this program? Objective of this health camps or health mela in the CHCs by medical colleges is to provide screening, diagnosis, basic and advanced healthcare services through specialized care. So specialized care will be given in case of diagnosis and treatment. Okay, so this is the logo for banner for community health center weekly health mela. So we can understand that here also it will be weekly basis. So first objective is giving specialized diagnostic and treatment services, available specific services up to the block level. So expansion of special service up to the block level to enhance the clinical material and training to the medical colleges. So medical college will have more cases. More exposure for their research and for practice. These are the three objectives. So benefit will be to both, not only to the block level to the people, but the medical college also will be benefited, as there will be the academic benefit by handling many more cases. So if a medical college is doing undergraduate training, postgraduate training, the students will be involved under the guidance of the specialists, so that they will get more exposure in the community level and they will enhance their skills in diagnosis and treatment. What is the operational framework? An overseeing committee will be formed at the state level by the medical college, district level by the CMO office, and director medical college at the block level by the BDO and medical officer in charge of that community health center. Okay, what will be the staffing pattern? That will be much more, that is very important. So from this we shall know that which specialties will be involved. So we shall be involving physician, that is internal medicine, then ONG, pediatrics, surgeon, anesthesia and dental. So these specialties have to be involved in the health camp. So these are the minimum requirement. Site selection. Site selection. So aspirational block will be a priority. I hope you know what is aspirational block. We can also have a video on this in future classes. So medical college will be supporting 4 CHCs, one medical college every Saturday, one CHC. So one medical college will be covering one CHC every Saturday. So every month they can reach out to 4 such CHCs. So what are the services which will be delivered? First of all, general OPD. Okay, then they can do surgeries if OT setup is there. Then obs gynae, specialist antenatal checkup, ultrasonography, counseling regarding medical termination of pregnancy. So these will be provided by the gynecologist. Then eye care by ophthalmologist, ENT services. Eye care, they can do cataract surgery. ENT services, chronic suppurative otitis media management, surgical correction of DNS, okay, psychiatry, derma. So in psychiatry, dementia, depression, obsessive compulsive disorder, Parkinsonism, substance abuse, erectile dysfunction. So these are the basic services. It is expected to be given by psychiatrist in the MELA. Dermatology, management of disorders like tinea psoriasis, then sexually transmitted infections, vitiligo, candidiasis. These are the ailments which are expected to be managed in these health camps by dermatologist. Palliative services to bedridden patients, pain management, rheumatoid arthritis, osteoarthritis, okay, peripheral neuropathy, in such cases, and cancers. In such cases, palliative care will be given. Diagnostic services in the health camps, endoscopy, colonoscopy, DEXA scan, mammography, orthodontic related procedure. Oral health or dental, Here they will give services related to endodontics, prosthodontics, periodontics, orthodontic. The lifestyle promotion, other activities such as can be performed by the staff of the CHC, like Ayushman, card generation, Bhavah, ID generation, population innovation, these activities. Now, what is the infrastructure required? So there should be in the CHC, there should be measures for fire safety. Number one. Then operation theater is another requirement. Infection prevention measures should be implemented. Should be functional in the CHCs. Then it should be connected with the ideally it should be connected with the common biomedical waste treatment facility. So these are the infrastructural measures we need to consider if a health camp is effectively to be conducted by a medical college in the CHC. Now, what is Ayushman Sabha? The third major component of the Ayushman Bhavah campaign. What will be the activities done? Here, Ayushman card to eligible beneficiaries, displaying list of beneficiaries who have received treatment by PMJY. So, Ayushman card and AB PMJY success story by line list. So those who have received the benefit, we shall display. Now awareness generation regarding non-communicable diseases, TB, SCD. These will be done. So basically this is a meeting. Their services will not be provided. So basically there will be awareness generation in this Gram Sabha, so that people become aware and the benefits being given be highlighted to the committee members and general population. This is the main issue. How it will be implemented? The Ayushman Sabha will be led by Village Health, Nutrition and Sanitation Committee, then Ward Committee, then Mahila Arogya Samiti or MAS, and the Panchayat Raj institutions, PRIs, in both Gram Panchayat and Nagar Panchayats. This Sabha, when it will be conducted? Conducted along with Gram Sabha scheduled on 2nd October. What will be the activities to be done in the Ayushman Sabha? Activities like Ayushman, we have discussed card generation, Bhavah ID generation. So Ayushman card, Bhavah ID can be generated. Then awareness regarding NCD, TB, routine immunization, SCD, Ayushman card, Bhavah ID, and ABHWC. In the beneficiaries, experience sharing. Beneficiary experience sharing. Experience sharing by AB, Ayushman Bharat Health and Wellness Ambassadors. Community champions. Then Ekalava School wardens. TB champions. SCD beneficiaries. So experience will be shared by all of them and it will be discussed in the mail in this Ayushman Sabha activities. Another component of this Ayushman Sabha will be discussion on the TB Mukt Panchayat. So we shall understand what is TB Mukt Panchayat, what are the indicators of this TB Mukt Panchayat. So number of presumptive TB examination per 1000 population. Per 1000 population is an indicator. What is presumptive TB? Those who are having symptoms but diagnosis is not confirmed. So in NTP, discussion in NTP, we shall come in details to that. It has to be more than 30 per 1000 population. This is the benchmark for qualifying as a TB Mukt Panchayat. TB notification. So how many cases will be identified per 1000 population? Should be less than equal to 1 per 1000. Treatment success. Should be more than 85%. So more than 85 patients out of 100 patients need to be successfully treated under the NTAP program. Drug susceptibility test. At least 60% of the TB patient should be tested for drug susceptibility. Now, Nikshay Poshan Yojana. %100% of the patients should receive the financial benefit under Nikshay Poshan Yojana. Nutritional support to TB patients under Pradhan Mantri TB Mukt Panchayat Abhiyan. How much? 100% of the TB patients in that area should receive nutritional benefit under this Pradhan Mantri TB Mukt Panchayat Abhiyan. So these indicators need to be fulfilled by that Panchayat area to become certified as a TB Mukt Panchayat. Next activity is component is Swachhata Abhiyan at the health facilities. What will be the main aim is open defecation free village in the by 2nd October 2019. That was the target for Swachhata Abhiyan. Now in phase 2 of the Swachhata Abhiyan, there will be sustainability of the ODF should be open defecation free panchayat has to be achieved, and overall cleanliness of solid and liquid waste management. Kayakalp initiative. To improve the cleanliness, health facilities, infection control and sanitation in the health facilities. Now this time Swachhata Pakhwada will be celebrated from 17th September to 2nd October. Where this cleanliness drive and Kayakalp cleanliness drive and Kayakalp assessment of the health institutions will be done. Another new component which is being included is Ayushman Gram Panchayat or Ayushman Urban Ward. So in this, certain indicators or parameters will be highlighted, and the performance of the panchayat will be monitored depending on these parameters and their performance against each parameter. So first parameter is Ayushman card distribution for the people for the beneficiaries above 5 years of age. 100 it should be 100%. Bhavah ID generation more than 5 years of age beneficiaries also should be 100%. Then screening for NCD, diabetes, hypertension for people more than 30 years of age, 100%. Fourth is number of presumptive TB patients with TB examination in a year. Minimum 30 individuals per 1000 population should be 100%. Number 5, number of TB patients, treatment success. More than 85% should be 100%. Number 6, screening for sickle cell anemia. or sickle cell disease SCD, and card distribution up to 40 years age group should be 100%. So these are the components of the parameters of the Ayushman Gram Panchayat or Ayushman Urban Ward indicators. So friends, all these are components of the Ayushman Bhavah campaign, where to summarize there will be mainly three major activities components. Number one is Ayushman Aapke Dwar 3.0. Secondly, Ayushman Mela. Third is Ayushman Sabha. In addition to that, there will be Swachhata Abhiyan, TB Mukt Panchayat, Ayushman Gram Panchayat and Ward. These components also, in addition, have been included in the Ayushman Bhavah campaign. So I hope it has been very illustrative and understandable to all of you. So with this, I am going to conclude. Please go through the entire part of the video, and hopefully the content will be very much useful to you in your all upcoming examinations. Thank you everyone.